Buffalo Latino Lens, sponsored by Start With Sleep, The Doze, Neighborhood Health Center, the Hispanic Women's League, and the Buffalo Latino Village. Welcome to Buffalo Latino Lens. I'm Rocco Anastasio. For this month's episode, I wanted to take a look at fentanyl and opioid education within our community because this crisis has hit us tremendously here in Western New York. We're going to have conversations with the Erie County Department of Health, chat with folks who have lost loved ones due to overdoses, and share resources that are available right here in our community. I'm Rocco Anastasio, and this is Buffalo Latino Lens.
My name is Antonio Estrada. I work with the Erie County Department of Health. I'm in recovery. I've been in recovery for the last 26 years. This is very important to me to come out and be able to educate and promote all the different services that are for those who the last and the lost, those individuals who are struggling with substance use, and substance use leads up to a lot of the spread of some of the STIs, HIV, hepatitis C. So in our outreach events, I come out and I set up a lot of testing with our community partners and with our other co-workers to bring education and treatment to all the individuals who are out in the street today that are dealing with addiction and doing and engaging in high-risk behaviors. It's very important to educate everyone, to let them know that there's treatment out there, there's help out there, and we want to educate those who don't understand about addiction. They think it's something that people could just stop. They tell you, just stop doing it. It's not how it works. There's different pathways to recovery, and each individual, when they're ready, okay, it depends on that individual that they come forward and step into a program and get all the help that's out there for them. What I would like the public to know that addiction is a disease. It's all a matter of seeking out and finding the different treatments that the different pathways to recovery, just like I did, and that if I could do it, they can do it.
Have you used it?
Well, a long time.
My name is Antonio Estrada. I work with the Erie County Department of Health. I'm in recovery. I've been in recovery for the last 26 years. This is very important to me to come out and be able to educate and promote all the different services that are for those who the last and the lost, those individuals who are struggling with substance use, and substance use leads up to a lot of the spread of some of the STIs, HIV, hepatitis C. So in our outreach events, I come out and I set up a lot of testing with our community partners and with our other co-workers to bring education and treatment to all the individuals who are out in the street today that are dealing with addiction and doing and engaging in high-risk behaviors. It's very important to educate everyone, to let them know that there's treatment out there, there's help out there, and we want to educate those who don't understand about addiction. They think it's something that people could just stop. They tell you, just stop doing it. It's not how it works. There's different pathways to recovery, and each individual, when they're ready, okay, it depends on that individual that they come forward and step into a program and get all the help that's out there for them. What I would like the public to know that addiction is a disease. It's all a matter of seeking out and finding the different treatments that the different pathways to recovery, just like I did, and that if I could do it, they can do it.
Have you used it?
Well, a long time ago, my friend
Are they
had,
open
she had
in
overdose, but we didn't have no Narcan, so I put her in cold water.
Okay.
Put cold water on her.
Okay.
And she eventually
She came to.
came here.
Oh, that was a blessing because you know they're not coming to today. You really need Narcan, so make sure you keep some.
Please.
We're here on Wednesday,
Okay.
so you're able to.
Is this a problem?
You're able to get it from us.
Is this gonna be an issue?
Maybe
Okay.
I can come and help.
Oh, okay.
You can pass the word. Helping us is letting this community know that we're out here
Okay.
and that we're here to help them. We're giving out harm reduction supplies. So that would be great because everybody knows everybody in their own communities. So it would be nice if you just let them know we're out here from 1 to 4. Okay, appreciate it. I'm Paula Bridgeforth. I work with the Harm Reduction Health Department of Erie County. Erie County, I am a peer navigator and I'm a lived experience person. I say that because for me, doing this work that I do, I resonate with this work. What I have seen is the drugs actually change, and what I'm seeing is an increase in older folks that are actually doing cocaine and they're overdosing. So they're going in with the intentions to do cocaine, but in reality it has fentanyl in it and they're actually overdosing. Sometimes they have Narcan, most times they don't. So what we're doing over here is we're actually educating the folks because it's happening in numbers in our data to Black and brown people. That is the highest number of overdoses, Black and brown males in Erie County. That's what I can speak on. And that's from the data. So in saying that, a lot of times they're not educated on in prevention. They're also having issues with interaction, where they feel safe. We're coming to their communities. We're actually reaching out to them where they are versus trying to get them to go into a treatment program or do an outpatient program. We're actually meeting them where they are. If they don't want treatment until they're ready for treatment, we're going to be there with them and for them. And that's what it's about at the end of the day, because I didn't want treatment. I was one who did it through Christ Jesus. So everybody takes a different path. Are you there for the whole run? That's my whole thing. So we listen to a lot of stories. Some people don't want to do treatment because of different reasons. They might feel uncomfortable in that environment. Others have stigma going on with their families or their religion or whatever the case may be. At the end of the day, if you're really trying to help folks that are using a substance that is really active in their substance use, you got to come out here and meet them where they are. You got to hear their conversation, and you got to have some compassion in your heart for them at the end of the day.
My name is Jeffrey Broski. I'm a peer navigator in substance use disorder for the Department of Health, the Office of Harm Reduction section. Me and my team right now, we're seeing trends of lots of xylazine in the fentanyl supply and some fentanyl in the stimulant supply, such as cocaine and methamphetamines. And, you know, it's our job to find these high-risk areas through the maps and the police reports that we get and bring out harm reduction supplies such as xylazine test strips and fentanyl test strips and Narcan, so the people that are going to use the substances anyways, that they can use safely and, you know, try to steer away from overdose. So fentanyl is a very dangerous drug because it's made synthetically and people don't know the potency behind it, and it's known to be up to 10 to 100 times stronger than heroin. And people just call it dope on the streets, so they think they're using heroin, but they aren't educated in knowing that they're using something that's 100 times that strength. And then once you add xylazine into the mix, it's what they say that gives the drug legs. And you know, once the xylazine is in the mix with the fentanyl, it just is prone to give the user an overdose, more likely to give the user an overdose. The misconceptions that people have about opioids is they don't understand that it's all fentanyl on the streets. As a peer, I have lived experience. So when I was using, it was all Oxycontins or real heroin, and the drug supply that's on the streets now is just a totally different animal, and people don't realize the potency that comes behind it, how hard it is to juggle that substance use disorder, because with fentanyl, it has a very short half-life, so people don't just have to get high once a day. They have to get high, you know, every few hours, and they get what we call dope sick. And so people don't understand how hard it is to navigate that, especially while being on the streets.
My name is Angela Dieter. I am the director of the Office of Harm Reduction within the Erie County Health Department. Started this position in February of 2025. Previous background, I worked at ECMC in a project coordinator position and also a heavy background in social work. So I've been around the field of addiction in addiction medicine specifically for quite some time. And so blessed to have the opportunity to direct and lead the team over at the Erie County Health Department. I mean, there's a lot of factors that we take into consideration when we do scheduled outreach and flex outreach to address the specific areas that we're seeing that are popping up or experiencing increase in overdose. I think there's a lot of factors that go into it, one being seasonal. Right now we're on the east side, right near ECMC, which we've seen an increase in overdoses. The weather's getting nicer. There's, cold blue shelters are closing, so people are coming out more, needing more services. So it's really a hot season for us to be out here active in these communities hardest hit by this disease, and providing anything harm reduction related to them to keep them alive and safe. Yes, the current trends that specifically concern us and that we're seeing in the opioid crisis in Buffalo is that it's not just the opioid crisis anymore. It's evolved, and that's one of the changing things that we've had to evolve our office with as well. It's not just opioids, it's polysubstance use, contaminants that are coming in the drug supply, and we compare, overdose data that we get from HIDA office and also what our peers are seeing boots on the ground, patient and client centered wise. The things that they're seeing boots on the ground, health concerns, health issues, the overdose, medical concerns that they're seeing. So absolutely not just the opioid epidemic anymore. It's evolved, especially with polysubstance use and, the mixing of contaminants. Specifically cocaine and fentanyl, still seeing that. And we've seen other adulterants like medetomidine, xylazine, which cause significant health concerns as well. Meeting people where they are in the community is so important, and especially unique to our office, which I'm so blessed to lead. Our peers are able to be in areas where there are health deserts, where they don't have access to treatment care, bus routes. If you're living on the streets or you're homeless or you are, having all of these barriers to accessing care, our team's able to go and meet you where you are. And we also don't leave you there. When we meet you where you are and you have these, multitude of things going on in your life, we don't want to just address harm reduction and providing you safe use supplies. We also want to refer you and link you to the services that you need. There's so many unhoused individuals in Buffalo right now. We're experiencing, food disparities across, multiple communities. So there's a lot more that goes into it when we serve the individuals and meet them where they are, and especially not leave them there. Narcan is so important in preventing overdose deaths, and it's so easy to use, and it should be accessible to everyone and anyone. And available to everyone and anyone. And that's why we flood the streets with it, and we do outreach events and tabling events. And addiction doesn't discriminate. It doesn't discriminate by neighbor, by race, by zip code, by status, by socioeconomic status, by housing status. It's everywhere. So every life that we save gives that individual another opportunity to get better. I was blessed to work at ECMC in a co-localized addiction medicine hepatology clinic with one of the best leaders that really set the precedent for harm reduction and my belief and love for this work. As long as the motive is pure and you continue to do good, I think that great things can come. You know what? We've lost people along the way, but you know what? Every saved life is another opportunity. And it's a beautiful thing when you get to walk alongside somebody and experience the resilience that they still have with all of these things that are stacked up against them. And addiction, it's not a moral failing or a choice. It's a disease, just like anything else. So I think one of the common misconceptions is it's their fault. They chose to do that. It's not a choice. I don't think anybody would choose to wake up the way some of these folks do every day and fight the battles that they fight. So it's just the beauty in the work, and obviously the power of the team that I get to lead and that stands behind me. That's exactly what keeps me going. I think that's one of the best parts about this office is the peers who have lived experience, and they have the ability to connect with those individuals and say, I was there. No matter what situation they're in, they have lived experience that they can compare and relate to. I personally, thankfully, do not. I do have, loved ones and family members that have experienced it, so I have seen it firsthand, obviously in patient care as well. But our peer team is so powerful because they can relate to those individuals and connect them with the resources and relate to what they're going through. But what they build in this community is trust. Trust among the community, trust among these individuals that are struggling, that they're not going to get arrested, or, you can come talk to me and, you know what I mean? I'm not against you. I'm not going to, report you. I'm here to provide services for you, to be there for you, and to be there ready for you when you are ready. Not on my time. It's not on our time. It's on their time.
We're out doing outreach. Every first Thursday, we're at Group Ministries at 133 Jefferson Avenue, doing outreach and doing testing. Every second Tuesday of the month, we're at the Bell Center. Summer's coming, so we would go back and revisit that schedule and come up with another plan to have testing in that part of town. We're at 1500 Broadway on every Tuesday, and we're at Grand and Ferry every Wednesday, and we're at Riverside at 132 Vulcan Street every Friday. So that are outreach schedules, and there's at the train station, the NFTA in the mornings, and then in early morning outreach in the Broadway area as well.
How well you sleep impacts how you show up in the world each day. My mission is to change the conversation about the way we view and prioritize sleep. Through my companies, Start With Sleep, I educate communities, workplaces, and schools. Through the Dose, we provide a line of sleep-enhancing products to help you sleep better and deeper. And through the Dose podcast, we offer you actionable tips to put the science of sleep into action. Are you ready to show up at your best?
When I come in here, if I've got a list of questions, they take the time to listen to those questions. We talk about them, they answer them for me.
Para mí es como un clic que haya entre el médico, el paciente, y más si es del mismo idioma que uno.
We've proven that if you come to our health center that your health's going to be better than if you go to many other places.
I believe we provide the best type of healthcare there is.
This segment of Buffalo Latino Lens is sponsored by Neighborhood Health Center, healthcare that welcomes you.
Hello, my name is David Danis from the Lower West Side. We're here to bring awareness. I recently had a friend called James Skippy Lemon, as we see right here. He passed away a few months ago from fentanyl. For those that didn't know Skippy, and for those that confirmed that did know Skippy, Skippy was a person that would reach out to everybody. He would show up, sometimes randomly, but he always showed love and a genuine heart in every conversation and with every relationship he had. It hit home with me. I never thought it would happen. No one is expendable. No one is, this could happen to anybody. How do I put it in words? For those who don't think this could happen to them, it happened to me. And if you're not ahead of it, you can go what I went through, which I don't wish that on nobody. The way his passing impacted me is the fact that, honestly, I wasn't prepared for it. So it impacted me to do what I'm doing today, making others aware that it can happen to anybody. So be aware. There's people that will help. I reached out to a couple people, and they're willing to help. You know, the signs that we got to look for is, you know, just talking to somebody. I mean, I don't know if there's a direct sign or not, but I do know that people struggle more than others. And, you know, just reach out for help. Like, honestly, I'm here to provide connections and phone numbers to anybody who just wants to be ready in case. If Skip was here today, he would want everybody to know that don't let this happen to you or your family. You know, Skip struggled like any one of us. However, like, don't let it happen to you and your family. Don't happen to your loved ones. People do what they do. It's not judgmental. It's reach out. You know, he confided in me. He trusts me 100%. But if he knew that that was gonna happen, he would have been like, yo, let's be ready. Let's be aware. Let's make sure we have stuff put to the side in case it happens. I learned things we could do better. So if I learned, and I'm still learning, he want everybody else to learn more and be aware for whatever, because there's people that struggle, but you know, it's not about addiction. It's about, you can make one wrong move and it could cost you your life. So everybody should be aware that be careful what you're doing. Be careful where you get things from, and also make sure you're always ready for whatever. There's a lot of resources out there. I reached out to somebody I knew. There's always somebody we know that got connections. My genuine things, if you feel you're gonna be judged for what you got going on, reach out to somebody that understands. Reach out to somebody that won't judge you for what you're doing, but also will be like, I understand I was in your position before, or, you know, you don't have a problem like you think, but still always be aware. You know, I reached out to somebody that I like what's called boots on the ground. They'll come to you and say, here, nobody got to see you if you're that type of person that feels that way. You know, or Department of Health. They're another connection that somebody else reached out to them for me. So there's a route for everybody to take. You choose your route, but also make sure you're safe, because it's not just simple things. I just seen on the news the other day, vape got certain things in it that could take you out. What gives me hope is someone like me who went through what I went through, and I'm willing to sit here and talk in front of a camera that I never really would do this. The hope is more people like me that's not camera friendly, but willing to sit there and make people aware that it's not about addiction, it's about awareness. It's about helping your community at large, being a resource, being a connector. So my hope is that more people would do that, more people will reach out and make sure they're ready for anything such as what happened. About a week after Skippy passed, we had a reception right here on 10th Street Park. And the number of people that showed up, I want to say we're in the hundreds. That showed that he was loved. Some people come for attention, but some people come for genuine love. He was shown love from many different places, many different people, even at the funeral. So he definitely left an imprint on many hearts, many minds, many souls. So if he did that, there's others out here that I love similarly as well. My thing is appreciate those around you. Love them, call them, reach out to them. One lasting memory of Skip. This is for those he reached out to and touched. Love those around you like he loved you, however he loved you. Don't just pick up the phone because you're upset. Don't miss a text. And this is not coming directly at nobody, because I've dealt with people like that in my life that I love, and we sometimes get upset with them over nonsense. So put that to the side. It's okay. Don't let it harbor in your heart. But those who's here, reach out to them. Show them love, because he would do the same thing regardless to what. And we could leave that imprint on everybody else's life. We're doing it for him, or we're doing it for those like him that are still here, living, breathing. Now, me personally, I would like people to know about fentanyl. You gotta be aware and ready. It's not about addiction, it's about awareness and preparation. If I'm willing to sit there and do that and admit that I wasn't prepared, there's many people out there that are not prepared for a situation to happen. And it's not about addiction, it's about a bad batch, it's about a bad choice, it's about getting the wrong thing from somebody that may think they're a chemist and they mess something up. It's just a way of life we live. So people should and must be aware that that is a pandemic. I heard about it years ago, but now it hit me home close. So I have things in my disposal in my car. I've learned lessons of how to, something's wrong with somebody, what signs to look for to give them it. And I'm still learning. So we should want to learn how to sit there and reach out to these people, because whether you're an addict or not, you should be aware for anything to happen when it comes to a vape, when it comes to a bad batch of whatever it is. And, you know, marijuana, it's coming more and more. Don't let it hit you at home. Then get prepared. Be prepared for whatever. Look for help. If anybody sees me around, I got a phone number. I know somebody that will come to you. I got a phone number. I know you could go to you could go to an office downtown in Buffalo or wherever they're at. There's many of them. So let's not wait. Let's prepare and help one another out.
How well you sleep impacts how you show up in the world each day. My mission is to change the conversation about the way we view and prioritize sleep. Through my companies, Start With Sleep, I educate communities, workplaces, and schools. Through the Dose, we provide a line of sleep-enhancing products to help you sleep better and deeper. And through the Dose podcast, we offer you actionable tips to put the science of sleep into action. Are you ready to show up at your best?
When I come in here, if I've got a list of questions, they take the time to listen to those questions. We talk about them, they answer them for me.
Para mí es como un clic que haya entre el médico, el paciente, y más si es del mismo idioma que uno.
We've proven that if you come to our health center that your health's going to be better than if you go to many other places.
I believe we provide the best type of healthcare there is.
This segment of Buffalo Latino Lens is sponsored by the Hispanic Women's League. Empowering dreams, elevating communities.
I'm Phil McNamara. I'm from Buffalo Resilience. I'm the founder of Buffalo Resilience, and we're here this morning on the corner of Broadway and Miller. Together with a couple of organizations, we have connections to Giving Back with Yvette. We have Woman to Woman with Dawn, and we have lots of volunteers who've come out with us this morning. We come out here on Broadway and Miller once a month. We come out on the second Saturday of every month. And we do lots of different things, basically just to try and support our community. We provide hot meals here with Buffalo Resilience. I can talk you through what we do. We have Tiffany here who's giving out coffee. We've got coffee, hot cocoa, tea, water. During the summer, we bring kind of colder supplies, ices, ice lollies, things like that for people depending on the season. We try and bring seasonally appropriate food and beverages. So we rely on donations from local bars and restaurants. Buffalo Resilience was formed as a response to COVID-19. I used to work in the bar business locally here in Buffalo, and a lot of bars and restaurants reached out to me to try and support their community. So we connect bars and restaurants, they donate food, catering overage directly to us, and then we try and make that to the community. So we work here on Broadway, we work with the community fridge networks, we work with lots of other community organizations that are boots on the ground all around Buffalo, getting food to neighborhoods and communities that really need it, that are underserved or that are looking for help. It's very easy for individuals and for communities in general to not see the world that exists. You know, you get in your car, you stay in the 90, you stay in the 33, you go to work, you go home. It's very easy to see these neighborhoods that are very underserved, that have been, they've been disinvested in for decades, and that just really need help. So we've been here for the last 4 or 5 years. Every month we go out into different neighborhoods around Buffalo as well to try and serve those areas and those communities that really don't have services or that don't know how to access those services if they do exist. There's lots of great services that are available here in Buffalo, but there's a big gap from those larger kind of really heavily funded organizations that are doing great work, but it doesn't always trickle down to the people right on the ground, right in the community. So there's also lots of private businesses that want to help and give back, but this community really shouldn't be reliant on private businesses to have to donate to fill that gap. But that's what we try and do. We try and take that goodwill of local neighborhood businesses, local professionals who want to give back, who want to help, and we try and find the right resources and the communities that need it.
Hi, I am Yvette, and I'm the founder of Connections to Give Back, and we are here every second Saturday or every month, or you could call my phone number and I could take you supplies as harm reduction, Narcan, or anything that you need. We try to give you resources, wound care, supplies, and what we do is we give back to the community and love on our community because we are left out. They forget about some of our communities. So we here as a community giving back to them. So the importance of the community to engage and be partnered is because we are with Buffalo Resilience. They bring out the food and stuff, right? The water. The importance is this community be left out. They're low income and they cannot get what they need or go to the doctors or whatever. So we try to maintain them and keep them alive. No matter what they do, at the end of the day, they're still human. And we should be, instead of dividing, we should be together.
My name is Elizabeth Smith, and I am the Assistant Vice President of Behavioral Health Services for Promesa Inc. Alba de Vida and the Upstate Region affiliates Promesa Inc. of Acacia Network. Some of the work that we do here is we provide treatment for substance use disorder. We are also integrated with mental health services, and we provide treatment here along with harm reduction to help individuals recover from substance use disorder. So Promesa hosts a vending machine. We're one of the hosts of New York Matters, and the vending machine is stocked with Narcan, the xylazine test strips, and fentanyl test strips. It is available to anybody here within the community and also our service recipients, family members, and it's very highly utilized. It's just pretty much as simple. It tells you what code to put in order to get whatever supply you're looking for. So you would just start by putting in the code 8377. And then it asks you for a date of birth, your zip code, and then the selection. So in this case, I'll pick Narcan, and it will vent. And the Narcan, xylazine test strips, fentanyl test strips are unlimited. So it is fully stocked at all times. We make sure the machine has all the supply needed at any time for anyone to come and grab what they need. And that's how easy it is. It's all free, no charge to anybody. Narcan is very important to have on anybody. This is life-saving, with proper usage, and there is obviously, some directions inside of how to utilize this and how you can use it. But we also provide training here at Alba de Vida on how to become Narcan trained and properly also administer. We could do those trainings for anybody if need be, but it's very important to carry, and it could save someone's life.
If you know someone struggling with substance abuse, there is help out there. On the screen, you should see resources that are available through the Erie County Department of Health. You also see maps on screen that are listed throughout the city of Buffalo and beyond that show the locations of vending machines that have Narcan and other harm reduction supplies. You can help save a life. Education is key. If you know someone struggling with substance abuse, there is help out there. Let's have conversations with our loved ones. Normalizing things like Narcan, keeping it in our first aid kits is something that we all should consider doing. We can help save lives. It all starts with education. I'm Rocco Anastasio. This is Buffalo Latino Lens, and I'll see you next month. Buffalo Latino Lens, sponsored by Start With Sleep, the Doze, Neighborhood Health Center, the Hispanic Women's League, and the Buffalo Latino Village.